Hello and welcome again with my good friend and co-host Vickie Mays. We are in Minneapolis at the annual meeting of the American Public Health Association. We are now with Lauren Weber, who is a reporter for the Washington Post and who participated in the session. And so we're really curious because when a reporter is interested by a session, of the American Public Health Association, there must be something terrific behind. So we wanted you to share this with us. And the session had a great name, actually, Empathy in Action. That's exactly what we want. Transforming public health messaging in a polarized era. So why would a reporter of the Washington Post cover that question?
So my beat is actually medical misinformation and the forces that are behind it. And in the world that we live in today, we are seeing just a torrential downpour of misinfo that, due in part to being exasperated by the politics of the day, but we're seeing it in all kinds of medical issues, as I know you all are well aware here in the public health field. And so they asked me to come on the panel to talk about my experience in my reporting and the stories I've covered, what I've learned from public health officials like yourselves as I work on these stories to see kind of who's behind this misinfo. Why is it seemingly getting worse? What are people doing to talk about it? So it was a good time to get to talk through some of those issues today.
So Lauren, is it getting worse?
So what I actually said on the panel is that misinformation has been around for a long time. We just maybe weren't calling it by that name. And, I gave an example in history. There was a huge yellow fever epidemic at the beginning of our nation's founding, okay? And at the time, you saw some similar parallels to what happened in COVID. There was a lot of political battles over quarantining, over treatments, over all of this. So everything old is new again to some extent. The thing that is a bit different now is that your misinfo can happen to you when you're scrolling on your phone at night. You used to have to go to the town square to hear someone telling you something. You didn't necessarily know if it was true or false. Now you don't even have to leave the comfort of your own bed. You can just be scrolling away and come across a lot of things that may lead you down some different paths. So it's a mixed bag. I think the jury's still out on if it's different.
But you can also have more access to good information.
And you can also have more access to good information. So the town criers have evolved into different town squares, so to speak. So it's a complicated question. I'm lucky to get to kind of dig into the folks that are behind some of the more nefarious misinfo.
Can you talk about how that makes your job either more interesting because you're trying to understand it or more difficult because you want to make sure, especially the Washington Post, we want to make sure that what you're presenting is actually accurate?
Yeah, I think the biggest issue and the thing I worry about the most is I don't personally want to be spreading incorrect information. Yes. That would really not be a great look for the misinformation reporter. You got to make sure that you are getting the facts correct. And I think it is a challenge, but I think it's really important to kind of dig into these seismic shifts that we're seeing. People don't have primary care providers. They are not getting information that they trust about a lot of things that have to do with their health, a variety of issues from anyone reliable. And what I try and dig into with the stories and the accountability topics that I tackle is who's spreading this? Are they making money off of it? Show to people that what's showing up in your social media feed may have another reason behind it. It may be motivated by politics, maybe motivated by money, maybe motivated by greed. That's my job to kind of dig in and find out more about.
That's very interesting. Tell me, for you as a reporter, how do you measure the impact of misinformation?
The way that I look at it is a story worth covering. And that's why the impact is I try and look and see, is there a large audience that's being impacted by this information? Is there a lot of people that believe this and then are choosing to make a medical or other decision on it? That's how I choose to cover stories, is I try and pick ones that are affecting a lot of people and that often surprise people. You want to read something that surprises you and also something that uncovers something new. So oftentimes I try and look and see whether the misinfo is circulating. I did a story on birth control misinformation earlier this year. And, there was a lot of misinformation spreading on social media that the three of us are not 15-year-old girls. So we weren't getting advertised it on our phones. So there's a gatekeeping also that happens where we may not see some of this material in the fractured media environment today that is swarming around. And so trying to figure out where that is, and then most people think that's effective is something I work to try and write about.
Why did the Washington Post decide to have a person like you? I mean, it really is kind of a public service. It is a public health kind of thing. How did this come about?
That's kind of you to say. I mean, I think the Washington Post is driven in part by holding power to account. And right now there is a fair amount of power and money that's being invested in misleading people for a variety of reasons. And some of that has really trickled into it's exploded, I think, the rise of telehealth in the medical system. And so they thought it'd be a good opportunity to start a beat, and I got the shot. It's great.
Fascinating.
But from our perspective as public health professional, when you look at these issues of misinformation and what people believe, it's very important to have a measure of how the magnitude of the problem in the population. And because when journals are starting to report extreme cases, that everybody will really say, oh my God, that's not possible. It's also, isn't it a way of misinforming the public when you have one example which may be rare and all of a sudden it exemplifies?
I think this is a great question, and is why we need to have more data on this. Something I said on the panel today is that, and that I asked of these public health folks that are here today, is if we're for me to do my job, I do need to present the scope of the problem and the scale of it. So some of these things are quantifiable, some of them aren't. You all can do the science to quantify it for me, which I would love to see, in some of these different topics. But yes, absolutely. I think in order to tell the full story, you want to make sure you're able to kind of give a sense of scale. And sometimes you say, look, we don't know the full story yet because the data isn't available. Here are some anecdotal findings we're hearing from X states or X practitioners in order to kind of get our hands around it. But I completely agree that the more data and the more numbers you could put behind these things makes for a better story.
I can give you an example. For example, if you start saying people age 65 year plus, have lots of doubt about the vaccine and they are misinformed. Okay, that's one idea. But if you find out that 95% of that population in the U.S. has been vaccinated, it cannot be that misinformation in this group had a lot of impact. What do you think?
I think that's an interesting point of statistics that I did not do the polling on those two numbers, so I can't verify them on the spot right here. To be clear, want to make sure I'm not misinforming, but I think that the word misinformation sometimes gets thrown around a lot. It means a lot of things to a lot of different people. So I think we have to be careful to clearly define the universe that we're operating in. And for me, when I report, I make it very clear, these are the facts that I understand, these are the facts that I know, and I try and get that complete picture. But I think that, to your point, you can maybe believe something about a vaccine, but if you're still vaccinated, that is an important detail to obviously include in the story. So I think that said, there is growing vaccine hesitancy, which we are all very well aware of, and there are many surveys that would seem to indicate that, and data that does indicate that parents are exempting their children from vaccines. So obviously there's a lot of numbers out there that we have to make sure you parse through carefully, clearly.
Yeah, but Laurent, this for me needs to be qualified with numbers. Because when we say vaccine hesitancy, are we moving from 10% to 15%? Because 10% has been traditional prevalence of people refusing to vaccinate their children, or are we moving to 50%? That's a big difference. If it's still a minority, or if it becomes a majority of the population. And qualifying with prevalence data is from our perspective as population thinkers and public health people, it's always...
You got to give me the data. I would love to see it. I want to see the data from you all so I can write about it. But I agree with you. I think it's important to keep that in context. I'm looking forward to seeing more of those numbers as they come out.
Let me just ask you one more thing, because as we were talking, it's like it's a partnership. It sounds like, public health working with the media and vice versa.
I have to say it's not a partnership in the sense of that I cover you all. But yes, I very much appreciate when you all work with us to give us some of the data and so that we can cover it correctly.
Exactly. I was just going to say, really trying to encourage our members, because sometimes the attitude is that's being political. No, it's actually being a good public health professional to share the science and ways in which you then can get it out. So,
Absolutely. I mean, the more, and I said this to many public health practitioners that I've used in my stories that have been sources to me for a very long time, the more that I have the numbers, the data, the people that I can then better describe to our readership what's actually happening, the better off, the more complete picture we all have. And at the end of the day, I think in public health, and I think in general, people want to better understand what's going on. And so the more information we have access to, the better.
and I guess the last question would be about communities in terms of, kind of their receptivity to the information and your ability to be able to really communicate it. How do you think about those things?
I mean, I think a lot of that is on trust. I mean, if I'm asking someone to share their story with me, I think it's very important to be upfront with them and say, like, this is what I'll be doing. This is the questions I'll be asking. This is where this will go. It will end up in the Washington Post. It will live online, where I want to make sure you understand that. But I think building from a place of trust, of getting people to trust you to give you that information so that you can share it accurately, also means that I need to convey it accurately. It's a two-way street for everyone in the trust equation. So I think that is a critical piece of it. And I also would encourage folks, I am obviously a reporter, so I want people to talk to me, but the more that there's a conversation early with all members of the community, the better off the story is, the better off the telling them all of it is, because you actually can capture these voices that maybe sometimes aren't the loudest in the room, but are just as important to the whole picture at hand.
Yeah. And as an
Sounds good to me.
editor, I have the greatest respect to reporters like you, because you really do a careful job to understanding the issue, and then you can translate it and express it in a way that nobody else can do. So you are very key for us and for every scientist for our messages transmitted to the population and to the public at large without misinformation.
Well, we do our best, but I appreciate that. It's kind of you to say.
Thank you very much, Lorraine, for your time and from having had such a great conversation at APHA.
Thank you.
So, bye-bye, everybody.